Good day, learners. I'm Dr. Esther Oladele. I'll be taking you through ECE 125, course title, Health and Diseases. Today, we'll be considering the topic, issues relating to well-being of the mother. By the end of this study session, you should be able to define maternal well-being, highlight the pregnancy symptoms. You should be able to list the various stages involved in fetal growth and development, as well as being able to explain all that takes for the child to be taken care of by the mother, the survivor, the growth and development. As definition, maternal well-being simply means taking care of the mother before pregnancy, during pregnancy, even after pregnancy. Maternal well-being has been associated with reproductive health care, services that are given to the pregnant women. It is referred to as the total well-being of a woman that is within the childbearing age. And when we are talking about childbearing age, we refer to the age of 15 to 45 years. Maternal health is usually directed towards promotion and maintenance of the health of a woman for childbearing as well as weaning, even after delivery. How is the mother being taken care of? Maternal well-being encompasses all the conditions of the anatomical and physiological aspects of the woman's reproductive system and organ. That is, those things that have to do with body structure, how the body functions, all the metabolic activities that take place within the body system, even within the organs, are to be well taken care of. Maternal health is therefore referred to as the foundation for healthy children. What do we mean by this? For a child to survive, develop very well, the mother has to be taken good care of so that the baby will come out as expected. Here, it is important to take note of the following. What is the health care given to the pregnant woman? Right from conception. In fact, we have to take care of the mother from the beginning, looking at the antenatal health care, prenatal health care, postnatal health care, reproductive anatomy. I said before, the body structure, and physiology, that is the body function. Then the fetal development, that is how the baby is seen to be growing within the mother. We need to find out and examine the reproductive system and organs during pregnancy. In fact, the diet is very, very important because during pregnancy, whatever the mother takes in or eats determines what will happen within the mother as the baby is growing. We also look at the maintenance and promotion of maternal health, the examination of the breast to ensure adequate provision of the needed nutrient of the fetus is very, very important. All of this will be taken note and taken care of by the doctor during antenatal. Also, the personal hygiene of the pregnant woman, very, very important. She needs to be very, very neat at all times. Whatever she eats needs to be very clean, the dressing and everything. Health education is also important for pregnant women. What are the do's and don'ts while you are pregnant? Drug and alcohol education, this is very important. In fact, from various researches, it has found that the use of alcohol during pregnancy can cause child deformation. It can lead to a lot of abnormality while the baby is still in the womb, even after delivery. Vaginal examination, this is very important. The doctor gets to examine the vagina to see even if it is safe for the mother to deliver through the vagina. We also talk about causes of maternal death. What are those things that can lead to the death of the mother, even during delivery and after? We also need to look at prevention of maternal death through antenatal health care. What are the disorders of pregnancy? What are those things that go wrong while in pregnancy? Disease associated with pregnancy. Diet in pregnant women, this is very important. The woman must make sure that she takes in a lot of carbohydrates, protein, fats, minerals, vitamins, and water. Very, very important. What are the symptoms and signs of pregnancy? Mixed period, enlargement of the breast, nausea, vomiting, change in frequency of urination, fatigue, you're always feeling tired, and increased vaginal secretion. Now, let's quickly take the different stages that are involved during pregnancy. The first one is the first trimester, and that is between 0 to 14 weeks. What are those things you notice within the baby development? The head is enlarged, and then that's when kidney and liver begin to function. During the second trimester, that is within the 14 to 28 weeks, You will notice that the fetus is clearly human now. Before, you cannot even see, is this a human being or not? Now you can see that clearly. The third trimester, we'll look at the skin. It becomes reddened, wrinkled. The lungs are well developed. The lungs can now support the baby. In fact, the baby needs to grow until full term to be said, okay, the baby is ready to be delivered. The head has to be proportionate to the body. The ears and the nose and the genitals, now, at this particular stage, they are being formed. In summary, you have been able to understand what is meant by maternal well-being. We were able to highlight the pregnancy symptoms. And these symptoms, we said, include vomiting, frequency of urination, breast tenderness. Some people even experience a form of secretion from their breast. Then we also talked about feeling very tired, weak and fatigued. We also moved on to talk about the different stages of fetal growth and development. Those are the different stages at which we'll discover the several growth and development formation. At the end of the day, we have why it is now important for a woman to take care of herself during pregnancy and after, even up to weaning, so that the baby will come out as expected. Thank you.